Hi, Dr. Miller. Thank you so much for this opportunity to answer some of the questions our Chinese audience um, may have. And because you, as the founder, even though many of our MINT communities, or not MINT, MI communities, have not met you, but we have read your books and we have received many different trainings through different channels. So a lot of us have heard a lot about you, and we certainly recognize your name and also Professor Rodnick as well. So one of the first questions we would like to ask is that for the general public, motivational interviewing may sound quite technical. Could you explain the core ideas of MI in plain language?
Basically, motivational interviewing is a way of talking with people about change they're considering, change they might want to make or need to make. Um, and we go through a variety of steps along the way. But the first of those is just engaging, is listening well, showing that we are interested and don't know this person, that they are the expert on themselves. And so that initial step of engaging is very important. Then there's a step of deciding what we're talking about. Where would you like to go? What are the changes that you're considering? And that one we call focusing. And then the one I think is most unique to motivational interviewing is then really interviewing the person about why they would want to go there, how that's important to them, why it matters to them, what are their own motivations for making this change. It's almost the opposite of telling people what to do and why they should do it. Instead, it's finding the person's own interests and reasons and values. And with those steps in place, then to begin talking about how the change might happen. So often in helping services, we try to jump directly to planning how it will happen. And these initial steps are very important as a way of laying the groundwork and engaging with the person, because they're the one ultimately who decides whether to make the change.
So this sounds very person-centered.
It is indeed a person-centered approach. And just as important, I think, is the mindset, the heart set with which you come to this. One of partnership with the person rather than I'm an expert on you. We're not experts on anyone else. Acceptance of people as they are, compassionate interest in the person, and then empowering the person, which is not giving them something they don't already have, but rather helping them to see what they already have and how to use the skills and wisdom and talents that they have to make the change.